Oh, it says it hasn't started now. Let's see. Are you still live?
Yes, it says we are live now.
Okay.
Are you guys seeing it? Perfect. Right.
Okay, maybe it takes a second.
Yeah, I think it's a little. Perfect. Well, thank you all so much for joining us. For this panel today, we are so excited to discuss this very important topic a little bit more in depth with everyone. I guess we can start with introductions. I'm Natalia, Jasso. I run Inclusion is Sweet, and I serve as Executive Director. Melanie, do you want to go ahead?
Sure. So I'm Melanie Cawthon. I'm the Executive Director for disABILITYsa.
Sabrina?
Jennifer? Oh, sorry.
Hi, I'm Sabrina Epstein. I am the Executive Director of Artful and a disability advocate.
Jennifer?
Hello. Yes, I'm Jennifer Allen, and I have worked on the Driving with Autism initiative and was former director of the Asperger 101 organization.
Awesome. Larissa?
Hi, I'm Larissa Martinez, and I'm the founder and executive director of Circle of Arms, and I'm glad to be on this panel.
Awesome. And then the councilwoman.
Thank you. My name is Sandoval. I'm the councilwoman for District 7 here in the city of San Antonio, and I chair a committee, council committee on health, and I'm very glad to be here. And Melanie is an appointee of the district on one of the many boards and commissions that we have.
Yes, awesome. And then Ron, do you want to go ahead and introduce yourself?
Good evening. My name is Ron Lucey. I'm the Executive Director of the Texas Governor's Committee on People with Disabilities.
Awesome. So today we just wanted to really discuss how we can keep all the members of our community safe in San Antonio specifically, but also across the state of Texas, specifically referring to the disability community and those with mental health issues, because we know it's just such an important topic to really help everyone be informed and aware of the different issues within these communities so that we can really help keep everyone safe. So Anna, if you wouldn't mind kind of catching us up on the recent legislation and work that you've been doing in regards to public safety and like policing.
Sure, absolutely. So it's happening in about maybe 2 or 3 different ways at City Council. I'll tell you that right now we're in the process of setting the budget for the next year, and there is talk about, you know, what size should the police budget actually be. So what the city manager has proposed is that we spend the next few months reevaluating everything. And I completely agree. I think it is time to look at the types of calls that the city of San Antonio receives to the 911 number and see is someone with a badge and a weapon really the best way to respond to certain calls. So that review is one aspect. The mayor has charged my committee, it's called Community Health and Equity Committee, to review specifically best practices around racial and gender equity when it comes to policing, and also to review mental health de-escalation measures in the police and best practices. So very excited to get started on that. And then lastly, I will say, just yesterday, our Public Safety Committee was reviewing 2 proposals by Councilwoman Andrew Sullivan, who represents District 2. And these proposals are to ban no-knock warrants and to ban lower vascular neck restraints or chokeholds. So that's what we're doing. It's a lot. I'll tell you more as we go on. Thank you.
Okay, awesome. Actually, Mateo just texted me that he cannot hear you. Is anybody else having that issue hearing us. If you just want to comment, and then Peyton is on our Facebook right now, so she can message. Okay, Peyton says it's all good. So must just be a browser issue. Awesome. Well, thank you so much for sharing that. Yeah, I definitely agree, especially in regards to mental health calls. Like you said, that there are just certain situations where maybe having someone with a gun and a badge isn't the right step, or maybe not the right first step, especially not the correct immediate response when someone's in crisis. So Jennifer and Ron, would you guys like to share a little bit more about what you are doing on the state level? So with the Samuel Allen law?
Absolutely. Ron, do you want me to go ahead and give a little background first?
Yeah, go ahead, Jennifer, and I'll follow on.
Thank you. Okay. Yes, so that is a Councilwoman. That was wonderful what you just said, and it's so exciting to see this group of people being so concerned. And you know, so many of us with children with special needs feel isolated and frightened of that very scenario that you're talking about. And it's so good that we can now get together and speak. But years ago, when my son, who is diagnosed with high functioning autism, was even considering taking driver's ed, the district didn't know anything about students with autism, or at least the drivers that were training didn't. And then to even picture beyond that, of him getting pulled over by a police officer was very, very frightening, and really made me think about how he could be, his actions could be misinterpreted so quickly. And I could just imagine how that could go wrong, as I think every mom of a child with a challenge. So with that, Sam did go through and get his driver's license, but we found out quickly that there was a code that was in the system in Texas DPS called communication impediment with a peace officer. And the odd thing is DPS didn't know about this code. And so when Sam went to the driver's license office, they knew nothing about that. And so we knew that the work was in front of us, and what an opportunity this could be, and relieve a lot of people with communication challenge. So that was almost 7 years ago. And so since then, House Bill 1434 passed in the 84th legislative session, and what that did was put that communication impediment not only in the driver's license and state ID, but allowed us to be able to promote it in all the DPS offices across the state, which we have in Spanish and in English, and posters and brochures to explain that this could potentially, it's a choice, but if you do opt for it, it could protect you if the law enforcement was getting the training. So then that came to the second arm, which was the training, which we had done for DPS trooper recruits in different police entities, including SAPD, and that has culminated in a training that is now on what's called the TCOIL, and that is a statewide training system. And so we teamed up with UT Health Science Center. So we went with doctors, we went with law enforcement, and we were able, through SAPD, Chief McManus allowed us to do a pullover of somebody who was deaf, which was Emma Faye Rudkin, and Sam, who has autism. So this is now available in a statewide training on TCOIL. The third element, which is the Samuel Allen law, was passed in the last legislative session, Senate Bill 976, and what that dictates is a person has an option to, when they're registering their vehicle with the Texas DMV, to register as a person with a communication impediment, and that goes into the system where when an officer pulls you over, it will alert the officer of the person's diagnosis prior to approaching the vehicle.
We recently got data on how we're doing with both of those options. We learned from the Department of Public Safety that we're at nearly 11,000 individuals who have chosen to have communication impediment with a peace officer put on their state driver's license or their state ID card. It's a pretty good number. And then with the passage of Senate Bill 976, the Samuel Allen law, that's only been in effect since September, but we already have 1,000 drivers who have associated their vehicle registration with that communication impediment with a peace officer code on their license. Currently, that data is available to law enforcement officers in TLETs, the computer system they use in their vehicles, but DPS and DMV are working to make it more prominent so that there will be a flag that will pop up and highlight that information for those drivers so that the law enforcement officer doesn't have to search for it with every license plate that they look up. As Jennifer said, the data would not be enough if it wasn't the hard work that Jennifer and Samuel did to provide the training as well, and having these peace officers trained both on how to interact with drivers with autism or Asperger's, and also the training that has already been out there for law enforcement officers interacting with deaf Texans has really made this a complete package. We know there's a lot more work to be done, and it always helps when citizens like Jennifer come to government, not with just a problem that needs to be solved, but with also the solution. I believe I met Jennifer on the first day of my new job, going back to December of 2015. And it's just been a pleasure to work with her and her son, Sam. The Governor's Committee has partnered with Jennifer and Sam to promote this program. We provide posters and brochures in all DPS driver's license offices. And so I have a son who's on the autism spectrum, and when he went to get his learner's permit, which made me nervous as heck, being a father of a young man getting learner's permit, he was also offered the option to put this code. And of course, I pointed out the posters hanging right on the wall, right there where he was getting his license. So we're keeping the office is equipped with posters in English and Spanish. And in addition to that, Jennifer has brought another opportunity to us with the billboard campaign. I think this is a good opportunity to do a screen share if you want to pull that up, Natalia.
Yes, let me get that for you. Here's the billboard.
So we have an opportunity to get billboard placement at no additional cost. We just pay for the printed banners and the labor to hang them up, but we're not going to be charged an advertising cost for this opportunity. And this will run in multiple markets: San Antonio, Dallas, Austin, and can't remember what the fourth market is, but basically all up and down the I-35 corridor. And we will also get placement on digital billboards as well. We wanted to go with a vanity URL that would be memorable. If you can imagine driving down the freeway at 55 or 65 miles per hour, you just have a few seconds to grab that driver's attention and get them to grab a memorable URL, unless we're fortunate enough for there to be a terrible traffic jam or traffic snarl, and then they can look at this billboard for several minutes and really take it down. Jennifer, can you recall, did I get all the correct markets for this campaign?
You did. I believe that Lamar Advertising said that they're going to try to get us in more markets, especially with the free digitals. So we should be in pretty much every city within Texas as far as digital goes. Now the billboards, the standing billboards, you're right, Ron, will go up and down I-35, San Antonio, Austin, and up to Dallas, which is wonderful visibility. And we are so grateful. I guess, you know, that just goes to show you don't know till you ask. And I just called around and I got a return call from Lamar, and they said, yes, this needs to information that's good and needs to get out there. And I think that's what's essential right now. It's a great program, and by all means, I think it can be built upon. But I think what grew out of this, which is phenomenal, and to me just just an unbelievable sign that God wanted this to be, is that it doesn't just include people with autism. People with a communication impediment, that's not a word we would all like to have, but it's the word that they had in their system. So if that's the case, who all would that constitute? Well, that can be Parkinson's. It can be deaf. It could be hard of hearing. It could be post-traumatic stress and certain mutism. So there is an awful lot of disabilities that can fall under this, which gives a protection, especially when you think about being pulled over and this popping up in red on their little screen in the law enforcement. And I think that that would just be thrilling to know that there's not just one disability that's covered, there's more. And I think that that is something that can be built upon, as this is the first in the country that we know of like this. So it can be tweaked, it can be improved upon. And I will mention this. I loved Councilwoman, what you had mentioned earlier about the training and it being imperative, and how will the law enforcement react? And there was an opportunity that, and when you said this, I pulled this piece of paper off of my bulletin board. I thought there's going to come a time to need this, and it's right now. But Officer Matthew Quintanilla with the San Antonio Police Department, this happened in May 14th of 2019. He it was near Splashtown, and he was on the highway, and there was, I don't know if y'all had heard about this, but an autistic young man had somehow gotten in the middle of 410, and he had the challenge to go up there and try to get this young man, from danger. And he was swinging a bat, and he was stressed, and it was just too much. And how he got there, is a story in itself. But this officer had been to training and said that he remembered the training of what to do to de-escalate, and it could have resulted in something so tragic, and it didn't. And I think that is one of the stories that Chief McManus had called me, and I got to hear more about it. I think they had done a press conference on it. But that's an example of how important training is to law enforcement, to better understand not just people on the spectrum, but people with all kinds of disabilities.
So Natalia, earlier tonight, I sent you a link to the website. If you could pull that up. This is when people follow that URL on the billboard, this is where it will take them. And we'll give you a quick tour of the website.
Let me get that up. Sorry about that.
No problem.
I have.
It seems like a pretty friendly, casual group.
I was like, I had the PSA up, but here we go. Awesome.
All right, so this is the Governor's Committee on People with Disabilities website, and if they follow that vanity URL, it will take us directly to this page that has Driving with Autism Initiative, and gives the background on the program, and talks about Jennifer and Samuel's story. We also put information, we get right to the point. How do I participate? How can I sign up? And it gives the link to the DPS form. Of course, they have to get their doctor to sign that form. It talks about also the form at the Department of Motor Vehicles and getting your vehicle registered. I've also always believed that the taxpayers shouldn't have to pay for the same good idea more than once. And so we have a cohort group of governors' committees in all 50 states. And Jennifer, along with the Department of Motor Vehicles and DPS, were very gracious in letting us record a webinar late last year on the Driving with Autism Initiative, and we shared it with those other states. The digital recording with the videos didn't turn out quite as good as we would like it to, so we hired a video editor to insert the videos, and we've published that on this website now. It actually turned out pretty well once we had it edited. So this offers other states an opportunity to learn about what Texas has done, and they don't have to do it exactly the way we did it, but it certainly gives them a template, and we included links to the statutes on this website as well. So we also include links to the posters and brochures if people want to print their own, and if anybody contacts our office, we're glad to send them a supply of those posters and brochures. Now, you know, the old 3 degrees of Kevin Bacon. In this world, we're all connected in one way or another. And MFA Rutkin also has a relationship to the Governor's Committee. She is a member of the Governor's Committee appointed by Governor Abbott to work with us. And we met Emma both through our Barbara Jordan Media Awards and I believe through Jennifer. So it was just fortuitous that we were able to connect that way.
Yeah, of course. And I think it's super important too to recognize that like it's not just autism, it's not just disabilities, like it's also for people who are deaf or hard of hearing or have other communication issues, because you know that can look like non-compliance to an officer when they're being pulled over, when it's genuinely just that they can't hear. Like that's, you know, that can lead to some pretty devastating consequences.
Ron and Jennifer, one question I did have that we've discussed before in previous meetings is when the code when it's on the driver's license itself, who's all able to see that code? Just because, you know, I would hate to have any disability discrimination based on a disability.
Yeah, that makes good sense. First of all, on the physical laminated card itself, on the front, it just has a letter C. And so if you're at a grocery store and they say, may I see your ID? As long as you don't flip it over, they're not going to know that you have a disability. And so that there's a lot of privacy protection there. In the TLET system itself, the only people that can see that are law enforcement. And once again, participating in the program is voluntary, and taking the second step and having your vehicle registered with the information is also voluntary. So nobody has to share anything that they don't want to share. But if they do share it, understand that it will only be shared with law enforcement on a voluntary basis, and people can withdraw from the program at any time.
And I will add, Larissa, that's a really good question, because my son did not want any bumper stickers. He did not want anything that would show. He said, Mom, I've gone through enough bullying, and you know, those bullies in middle school grow up to be big bullies. And so I really don't want people to know. And that was one of the things why when we first started talking with DPS, we had thought about, you know, or they had mentioned, why not do something like a designation, special one on the license plate. And I was real quick to say that's something that they can become targets. So that's
a lot of things have been, even the community of disabled veterans, they wanted a disabled veteran license plate, but they didn't want the international access symbol on their license plate. So it's more subtle. They have the branch of military service they were in, whether it be the Coast Guard, the Marines, whatever. And then they have a very subtle DV up in the corner of the license plate. So it's almost like a kind of a wink or a nod to each other that, you know, I'm a veteran with a disability, but they didn't want to promote to because of the reasons Jennifer said, you know, sometimes having the rest of the public know you have a disability can set you up for exploitation. Likewise, the Texas Commission for the Deaf, later the Office of Deaf and Hard of Hearing Services at HHSC, they had a visor program where people who are deaf could pull down a visor, and there would be a card that would let law enforcement know that they were deaf, and they also could keep the card in the glove box. But what do you think would happen if the police saw somebody reaching for their glove box or their visor as they were approaching the vehicle? Probably nothing good. So it's best to have the officer know in advance. That way their training can kick in. And as you said, some actions can be construed or misconstrued as non-compliance, but also think about other disabilities like Parkinson's disease or cerebral palsy. It can also be misconstrued that the person is intoxicated. They might think that the person is slurring their speech because of substance, alcohol or drugs, when it's just part of their disability.
Very, very true.
Yes, yeah, no, that's very true. And even with like diabetes, which is something that affects a huge amount of our population, if someone's having a blood sugar crisis, that can lead to, you know, speech difficulties and erratic behavior that can look like non-compliance. Ron, I also really liked how you mentioned that you guys have all the information laid out on the website as like from a statewide level so that other states can model. I've always like heard and learned about states being laboratories of democracy. So I think that's really important to have that model in our state so that hopefully we can have,
Right.
success and data to back it up to make this
Yeah.
a national program, because it's just such an issue with this
Right.
population.
Yeah, it's
Only
nice
person, okay.
it's nice to see something positive happening in the law enforcement space, and this is really a positive thing. Law enforcement welcomes it, and families of individuals with disabilities welcome it. So it's kind of a win all around to see this happen.
I was really thrilled that throughout all this, you never know what you're going to be met with, but most all the police chiefs in the larger cities in Texas were so willing and saying, yes, we want to learn, we want to know. And the Texas DPS with their trooper recruits would go up there many a time and train them, and found out that that what would keep me awake at night is to learn that the training that they would receive was on aggressive mental disorders. And for most of these law enforcement officers, they lumped autism into an aggressive mental disorder. So there is a lot of education that they get anyway, but to be able to do it in a concise format, we relied upon a lot of doctors to help us. And Dr. Temple Grandin allowed a lot of time. She let me record to be able to explain to officers what it's like for her, like a slow computer. She said, you gotta know we're slow to respond. Give us time to respond. And so wonderful practical applications were given by either people on the spectrum, Dr. Grandin, or doctors at UT. And what we found for the most part, law enforcement was really thirsting for such information.
That's really awesome to hear, and super encouraging to hear that, people, because I think everyone is on the same page with that. We would rather these things not happen. We would rather be proactive and have prevention over anything else, and make sure that everyone's informed. Larissa, did you have something to add? I know you were about to speak earlier.
No, I was just going to say that I've only seen this in North Carolina. It's not exactly the same, but it is like a disability awareness kind of like, they have a certificate actually, and it's held near their license plate so that it can, or their license, driver's license, so that it is signed by the DMV and the mayor and stuff like that. So it's an actual like certificate, but I definitely think this is definitely needed.
Yeah, because again, having to pull out a certificate again creates the potential for, someone misconstruing that as reaching for a weapon, or just again, all kinds of bad things can happen with that. So I think it's really awesome that it's built into the system. We had a question from a viewer asking, what about those with PTSD and anxiety?
This program is not excluding any particular disability. The eligibility statement, you have to get your physician to sign off on it. And if you have a treating psychiatrist, they could certainly put that down. If that were construed as a communication disability, communication impediment, then it would be appropriate to have that be part of it.
Yes,
and that's just going to be more good information to have the officers slow down their communication. Jennifer uses one of the best illustrative examples about how people with Asperger's may not understand idioms like, why were you flying down the road, or where's the fire? And so just speaking in plain language as a law enforcement officer can help avoid those misunderstandings and keep communication from going sideways.
Absolutely. Yeah, and kind of going off of that, when we're speaking of PTSD and anxiety, Larissa, did you want to share kind of about mental health first aid and the different resources in regards to that?
Sure, definitely. Thank you again so much, Ron and Jennifer. I definitely will share the information around on my platform. So we all know that mental health wellness is a platform for our society to flourish. And right now, our society is being plagued with so many different interruptions in our daily norms. And, we have COVID, we have isolation, we have online schooling, people working from home, just so many different things happening. So what Circle of Arms does is one of the main programs that we do offer is a mental health first aid. I have been, trying to connect and collaborate with different agencies and organizations, because I feel that mental health first aid is so important to have in each community, so that there is an awareness and there's education about signs and symptoms of somebody developing mental health illnesses, and also to help intervene during a crisis. I live on the Northwest, so I live in District 6, but there was an incident that happened 4 miles away from my home, where a veteran was mentally unstable, recently lost a loved one, and was suicidal. He had been, police officers had been called a few times to the house, and once that, last night they were interacted, and I do know that the officers did attempt to talk. They said about 30 minutes, that they tried to tase him to calm him down, and then aggression and all that. So, and he ended up getting shot, and he died. It saddens me, because there's different resources should have been used. Police officers probably should have been the last resort. What I hope to implement with mental health first aid training in all our communities, even in our subdivisions, in our HOAs, is that we have somebody close by ready to act. So mental health first aiders, what they learn to do is they learn, again, to recognize signs and symptoms. Somebody developing a mental health disorder, they don't diagnose, because they're not doctors. And they also learn that, okay, there may be a mental health illness that could replicate a physical issue, an emergency, like heart attack and panic attacks kind of have similar symptoms and signs. We also help train to certify them how to intervene during crisis. So there's a 5-step action plan on how to de-escalate, how to call resources when necessary. So these are all important tools to have in our communities, because again, we need to be looking out for each other, and we need to be able to lean on and help the officers out, because officers get burnout. They are overworked. They are dealing with a lot too right now. So I think just in general, utilization of other certifications that are other public community that are trained in mental health first aid could only help provide more skills and tools needed in our community.
Awesome.
It's also important. I'm sorry, one more thing. No. Within the class, we also teach about cultural differences, and we all know that cultural differences are a very big part of miscommunication. So we teach about how different people perceive different ways, right? They perceive different things differently, right? And sometimes people will only like to talk to people that look like them, that have experienced what they've experienced. So it's definitely beneficial to have a brigade of community first aiders that look, talk, and have experienced what your neighbor has experienced. And we instruct not only adult mental health first aid, we also instruct mental health first aid for youth, for military and veterans, for public safety, and higher education, and for the elderly. So those are all important.
Yeah, no, that's awesome, Larissa. Councilwoman Sandoval, did you want to share a little bit about the city's resources in regards to that? I know we had mentioned the mental health unit, and then also Stand Up SA. I know that's a program that you guys advocate for a lot.
Sure. So I'll talk a little bit about the mental health unit. It's 10 officers who have additional crisis response training. And it's wonderful. There's been a documentary on it. It just aired for the first time on, I think it was on Showtime. Just
Joe and Ernie. Yeah, the Joe and Ernie.
I'm sorry, what was it called?
Was it Joe and Ernie?
Yes, Joe and Ernie. Right. And it was started by two officers who, on their own, wanted to take additional training in crisis response, and now just about all of the police forces train in crisis response. This particular unit, it's called the Mental Health Unit, does some wonderful work with people who repeatedly have a crisis and call 911. And the idea is to get these patients, these residents, with the actual support they need, right? So that 911 isn't what they always resort to, that you don't have to get to the crisis level, right? That you actually manage the health needs that they have. It's wonderful, except there are only 10 officers that do this. And what does that mean? That means that we simply do not have enough officers for that need. It just doesn't scale up, right? If you use officers for it, because in all honesty, officers do a lot of things. We ask them to do a lot of things. They're kind of social workers for us. Sometimes they take care of dog issues or neighbor issues. But they are, for a city, they are one of our most expensive type of staff person. So we have to think about alternatives too, right? And especially if they're trained to deal with violent situations, that's not always the response you want, right? As we were saying earlier.
Right.
So in my committee, what we're hoping to do is look at the different alternatives for responding to mental health situations, or even things like homelessness, right? You don't necessarily need a police officer to deal with that. We have seen one model, it's in Oregon, called Cahoots. And if you guys are familiar, I will let somebody else talk about it because I've been talking enough on this. But I do want to say, we did great work with the mental health unit, but it simply needs a lot more resources, and it's hard to scale that up. So thank you.
Well, definitely. And that's exactly what our organization does as well. We want to help fill gaps, because we definitely understand there's a lot of great organizations out there. We're not trying to reinvent any wheels, but what we want to do is fill the gaps that, you are here working on these issues, and we can be here helping fill gaps, with these issues. And again, so these, just having people trained, just like we have BLS, basic life support, all over the place, so they can help in any instance. That's what these first aiders do for mental health, but it's for your mind. So first aid for your mind. I would love to talk more about just collaborating more and using more first aiders in our community to help.
Yeah, and going off of that also, I know a primary response that we've talked about before is when someone is in mental health crisis, is the Center for Healthcare Services in San Antonio actually has a mental health crisis line. I'm going to have Peyton put it in the chat on our live right now, but they have a phone number, and I highly, highly, highly encourage everyone to save it into their contacts, because you really never know, when there's going to be a situation that you need it. I have it pulled up as like crisis response. So if I'm ever in a situation, because I think when you're panicking, when you're, when someone's in a crisis, especially someone close to you, or maybe you yourself are in a crisis, your first instinct is going to be to call 911, because that's, what you're trained to do from like preschool. So I think really having other resources available, and then of course they will have the knowledge and the experience to know when it's necessary, maybe to pull in, backup or more, different measures.
It's also important to also realize that the communication part is different from everybody. I'm a veteran. I served in the Air Force. I'm also a military sexual trauma survivor, and I'm also now a peer support specialist. So people like to interact with people on all different levels. But when you're experiencing a crisis, it's so much different. They don't think about, let me pick up the phone and call this long 1-800 number. I know we have it changed now. There is with a whole bunch of discussions and talks and, everybody's input, they shortened that number where it's actually 4 or 5 digits. I have it somewhere, but it's easier for people to remember during a crisis. People will sometimes want to text. A lot of teens text. So there is that communication through text. And then some people want to speak face to face. And so I just definitely think that all those types of communication outlets should also be available throughout as well.
If I could chime in on that, I think it's true. We have been taught to dial 911 since you could use a phone, right? So it may be a little bit harder to teach someone who's in a crisis to remember something else. Like it's hard enough to do anything when you're in a crisis, right? You need help.
Right.
So, so I think one thing that I want our committee to evaluate or the city council to evaluate is, can we leave 911 as a dispatch, right? And then it's the dispatcher or the function of that unit to decide who they send out, right? So they do that right now, whether they send out EMS, a fire truck, or a police officer. So it does sort of expand that scope for them. Anyway, I think it's worth exploring and would love to hear thoughts on.
And also matching, I mean, I know when you're going through a crisis, you're not, people are not, they're trying to get information and it's hard, but just sending a match, because sometimes female to female, if there's been domestic or sexual abuse, they want a female. If it's a veteran, they want a veteran. That just to have that commonality, those grounds to start with.
Great point. Mm-hmm.
I think that's something also that Bexar County Sheriff's Office has worked on a little bit with their liaison program. I know we've looked at, they have an autism and special needs liaison, they have a liaison to the deaf community, they have a mental health liaison, they have all kinds of different, and then just like specific communities like the Muslim community. But yeah, I definitely agree that everyone wants to, they feel more comfortable, especially in crisis, with someone that has the same lived experience as them or maybe kind of survived it before. So I think that's really definitely worth exploring, having all populations have mental health training and support. Councilwoman, did you want to talk about not speak up essay, stand up essay? I always get those two confused.
You know what? Sometimes we get them confused too at the city. So this one is a little bit more about violence. It's actually called violence interruption, and I learned about it probably the first couple of weeks on the job as a city council person, and I think it's a fantastic program. So we were sitting in a budget meeting, my first budget meeting in 2017, talking about how much money we're going to set aside for the police, right? And because that's a big part of the budget. And my question was, well, police really get there after something has happened, right? Whether it's a theft or whether it's a violent situation. I said, what do you do beforehand? And is that in the police department? What do you do upstream to prevent these things? And I got a very general answer, and it said everything that the city does helps prevent violence. We train people for jobs. We support this. We have community centers. All of that helps avoid violence, and probably it does. But is it strategic in terms of where we see violence? No, right? We don't have it mapped. So then I was approached by two gentlemen who work for Stand Up SA, and they actually do they were in the police department at the time. Now they're going to be in the health department, which makes sense. We're going to have a whole section devoted to violence prevention. And so Stand Up SA is people who have been involved in violent situations before. They may have been a gang member. They may have gone to prison, and they are really, they resolve conflict, and they are out there in the community just having a dialogue with people. It's a very different way of doing it, right? From sending police to like patrol and see what's going on. they're just almost like the elders. So if there is a shooting or something that happens, a violent situation that happens, they will go to the hospital where the victim might be and talk through what happened, and give them the support that they need to recover from this, but also the support that they need so that they don't feel like they need to retaliate. Because retaliation, we know, that's how you have the cycle of violence, and someone else might die, and then somebody else dies, and somebody else dies. So that's really their role, is being in the community. They've been in the East Side for a few years. There is evidence that they have reduced violence there by 30%. And fortunately, we will be seeing a bump in the budget, even though lots of things are decreasing because of coronavirus. We will be hiring them on full-time. I was disappointed to learn that they were actually part-time employees, because if you've been in prison, you probably need a full-time job. It's not easy to get a full-time job. So they will be full-time employees. There will be more of them, and they will also be working in the West Side of San Antonio now. So I think it's just a wonderful improvement in our public safety, in what we call public safety, right? Public safety is beyond police officers.
Yeah, absolutely. Yeah, it's all about being proactive and prevention, and preventing those situations from escalating before we need that kind of intervention. I think that's really important. Sabrina has compiled a document of different crisis resources in San Antonio. Sabrina, did you want to talk about that a little bit? And I'll have Peyton put that in the chat on the live.
Sure. So like Councilwoman Sandoval and Larissa mentioned, knowing who to call in a crisis and knowing that it's not always the police is something that's really important, and also like very difficult to know. So Natalia and I put together this document, which should be in the chat of the live stream now, that includes many of the resources we already talked about. We have a section on nonviolent crisis intervention and trainings, as well as crisis responders who will actually come directly to you, such as the Center for Healthcare Services, which can do mental health and substance abuse responders, because substance abuse is another part of the disability community, honestly, that is often not served well by the existing policing structure, as well as the Rape Crisis Center, which has an online chat and can send a responder to help get you to whatever healthcare and counseling needs you have, which is really important. We also have some child abuse resources and the local initiatives like Stand Up SA and the Bexar County Sheriff's Office program. So like Natalia mentioned, they have developed a lot of different programs there that in the situation that you do feel like calling the police is something that you need, or if someone's already called the police, it's good to know what exists within the system, so that way you can try to have someone who has a better grasp on disability and mental health intervene, rather than just someone who may not have undergone that training. Because like we said, training programs exist, but they're not universal. We also linked some planning resources that have been put together by national organizations, like the Autistic Self-Advocacy Network, which has resources both for self-advocates and for parents and caregivers. And they also provide plain text and safety toolkits for planning what to do in mental health and behavioral crisis. And like we've said throughout this, again, that can certainly apply to people beyond just the autism spectrum.
Absolutely, yes. Thank you. And we'll definitely add the new, like Ron said, the vanity website for the Samuel Allen information. We'll add that to that document as well.
We could also to add the VA crisis line for veterans, which is the I have the 800 number and the text number.
Awesome. Yeah, of course. No, that's very important too.
That's part of the disability community that we need to think about in these situations.
Yes, for sure. I mean, as we saw last night on the news, everyone saw how that affects, I mean, not just physically disabled veterans, but also with mental illnesses and just the different behavioral crises that can result. Yeah, that's really important. So I guess our last kind of topic to discuss is, so moving forward, how do we advocate for these things? How do we ensure that there is more training? How do we invest in and support these organizations as citizens through city government? So Melanie, if you want to talk about the different paths of advocacy that you have kind of become an expert in the past few years. And of course, Councilman Sandoval, if you want to chime in too.
Awesome. Well, thank you so much. So there are some self-advocacy things that you can do, and then there's community advocacy that you can get involved in at a higher level. And so when you're having trouble or issues or things related to city services, you have access to the Disability Access Office. And so you can call them and they can help educate internally within the city of San Antonio, those departments that might need a little education on ADA compliance or how to work with individuals with disabilities, and they will help you to navigate and resolve your issues within the city. You could reach out to your city council person. I'm so blessed to be in District 7. Anna, Councilwoman Sandoval has coffee time with Anna, and you can just kind of book your appointment and get in there and speak with her one-on-one. And I know that several of the other city council people have various ways of getting a hold of them, and even just reaching out to their offices for support. I sit on, as Councilwoman Sandoval stated earlier, I am the appointee on the Disability Access Advisory Committee for District 7. So oftentimes when the District 7 office gets a call regarding an issue that revolves around a disability, they will reach out to me to find a resource or ask how they might be able to help their constituent, and I'm able to be of service in that way. And each council district has a connection to that disability access and has an appointee on that committee. You can take advantage of the Citizens to be Heard. So remember, our Disability Access Office, your city council person for the district that you live in, and Citizens to be Heard. And so there are a couple of different committees or commissions that report back to the governing agencies. So on the city level, that's the Disability Access Advisory Committee. So you can sign up to be a Citizens to be Heard, and then those appointees will get back to their districts, or they will submit a memo to City Council as a whole addressing the issue. You can, on the Bexar County level, reach out to the Technical Advisory Committee for Persons with Disabilities. That is the sister organization on the county side, and do that. Also, there's Citizens to be Heard, which each time there's a Citizens to be Heard, that's 3 minutes to say your piece about some kind of issue that you might have with governance. And so the city council as a whole has a Citizens to be Heard as well. And for that, it needs to be related to an agenda item that is being discussed in city council that week. In addition to that, the city of San Antonio, and I am going to share my screen now if that's okay. So the city of San Antonio has this 311 app. So say there may be a gap in the sidewalk where you live, you can report that through this particular app. So I would go through and look at the types of things that you can report through the app that the city has through 311. And then I would suggest, if you are reporting something through this app, then you also follow up with the Disability Access Office so that they can tag that and ensure that it gets processed through the right department and moves forward in the system. We have, let's see. Hold on, I need to shrink this just a little bit to get out from under that window. Then on the community advocacy side of things, you can this was referenced earlier, but you can always give your feedback on things that are happening in the city. Currently, disabilitysa is partnering with the Disability Access Office to, we put up this survey on gathering the experiences of people with disabilities during COVID-19, which after we get that data, I think currently we've had 290 people respond to that. And our intention is to ensure that those issues are then passed around to our city leadership to make sure that they understand what our community is going through and how they need to include that in the recovery and resiliency planning. There's always, whether it's the budget for the city of San Antonio, where do you want to see the city spend money, to street name changes, to all types of different surveys that impact the city, can be found at this website. You can serve on a city council or commission, which there are 1,012 different city councils and boards and commissions for you to choose from. Everything from housing to, transportation to the Disability Access Advisory Committee, and so on and so forth. So anything that has to do with our city, there's a commission, committee, or council that helps advise the city council on how to, or advise city departments on how they need to make decisions. This is pretty inaccessible, so I would suggest if you use a screen reader or some need assistance that you reach out to the Disability Access Office to help with your application, because you're going to have a really difficult time applying. I do know that this is part of the city's online renovation project to make the city's website more accessible, but currently it is super hard if you need some accommodation to be able to navigate the system. So please either reach out to our office at disabilitysa or reach out to the Disability Access Office to get assistance with completing the application if you would like to serve on a city committee, council, or commission. Then let's see, the same goes on the Bexar County side. So there are commissions that you can sign up to serve on. And while it's important to have people with disabilities serving on, of course, the Disability Access Advisory Committee and the Technical Advisory Committee for Persons with Disabilities, it's also super important to have people with a disability serving on all of those committees and commissions. And unfortunately, they do not ask whether you have a disability or not, but there's often a description. So when you're identifying yourself and describing yourself and your interests, you can put information about your disability in that section, just to kind of highlight you and note that you bring a diverse perspective to the table, because that's exactly why we want to serve on these committees and commissions, right? Is to bring a different perspective to that our community decisions are reflective of the entire population. You can also reach out to our office, let us know that you applied for a position, and we are happy to meet with those or reach out to those council people to let them know that a person with a disability has applied and they might want to look at that application, and we can help assist and connect in that way. And then let's see, just disabilitysa.org. So we are all about, I have so many windows pulled up on my screen and y'all have just seen my dirty laundry, just kidding. But we have a program where we help connect people with and without disabilities. So people living with a disability and those who want to advocate for the disability community can get involved. And if you just go to disabilitysa.org/advocate, there's a program participation interest form, and it is quite extensive because we're looking at how do you want to get involved as a mentor, as a public speaker, as a volunteer. When we get media stories, do you want to be a part of that public recognition of people with disabilities in our community? Do you want to serve on a committee, council? And then it goes through your education and background and job and employment and your area of interest so that we can help you find those areas where your voice can be heard, which is in your area of interest. So I of course highly recommend going and submitting this form so that we can help you get involved if you're kind of starting out, not quite sure how to start with advocacy. We're here to help you do that. And with that, I don't even know where and what screens you're seeing now, but if someone can help me stop sharing my screen, I think I did so many things that froze.
Yes, I stopped your
Thank
sharing
you.
now, Melanie. Thank you so much for all of that. You're just such a wealth of information when it comes to advocacy. I was like, she's got to talk about it. So many different ways to get involved. Councilwoman Sandoval, did you have anything to add to that of other ways, or did Melanie cover everything? Anything you wanted to?
Melanie covered a lot, but so we have people who come to us to advocate, and then your city or your local government, we also advocate to the federal government, or we advocate to the state government. And so in the spring, it's time for our state legislative session again, and I think it starts in January or February. And that's really where a lot of things can happen. So for instance, things that have to do with health, that will be part of our legislative agenda going forward. I think, we heard recently that the governor said something about what he would do to cities who decided to, quote, defund their police or reduce their police budget. He was going to reduce their taxes, I think freeze their taxes. So there would be a financial impact to any city who decided to reduce their police budget. So I think this is where we have to be careful where politics sort of intersects with the policy goals that we have. So remember, our policy goals, at least mine, are to make sure we have the best public safety response for our community that keeps them safe. And that could mean appropriate training for our officers. That could also mean that sometimes it's not an officer that does the work, right? That it might be a social worker or somebody else. And that still provides public safety to the community. So I think if you are so inclined to reach out to your state representative or your state senator and let them know about what's important to you when it comes to public safety and protecting people who have a disability or other things about public safety. We're not just talking about, at least in this conversation, we're not talking about abolishing police, but we're talking about having the tools that we need locally. And we don't want to end up being punished for using those tools to serve our community. So I would just be careful, watch what's going on at the state, and we will be there advocating so that we can do the best that we can to serve you.
I have a question about that because so the whole reason that I founded Circle of Arms, my nonprofit, was because I went through my own mental health journey, right? And healed and decided helping others is therapeutic, and educating is what's important. And so right now, along with racial injustices and everything else, right now a big topic, which I don't believe that a lot of leaders in San Antonio have been stepping up, is for the military sexual trauma that has been happening for a long time now, but has just recently been highlighted due to Vanessa Guillen, due to soldiers at Fort Hood. Now, I know people are so kind of like it's eggshells, right? Walk around eggshells because we are labeled Military City USA. I'm a veteran. In no ways am I anti-military, but I do feel that we need more voices. I know my organization has had quite a few different events to the community to kind of help spread awareness. We've reached out to so many elected officials, so many different district, like by email, by phone. 2 or 3 maybe have showed up since July. So to me, it's about being safe, being safe in our military and protecting our military, and it's about educating for the future soldiers, our future, our daughters, our nieces, our nephews, our just everything. So I just want to know, how do you go about that? Because we've been like, emailing, wanting that voice and more elected officials to talk about it, and I just don't see it.
I think you bring up a really great point, and thank you for pointing that out, because we do have a role. I think it's easy for me to think, oh, that's a federal issue, but at the end of the day, we are Military City USA. We passed, I think, an ordinance that says that.
Right.
We also partner a lot with the local military. If they need a new road, guess who's paying for it? We are. Right. And they invite us to their functions, and there's nothing wrong with being Military City USA, but I think what you're saying is, what does that mean, right? Does it mean that we also care about the safety of those people who have signed up to serve their country and their community, and they come to San Antonio to live here? We owe them. They become our residents, and we owe them that protection, that to be able to stand up for them too. So thank you for raising that. I would be happy to talk to you more about how we can be supportive in that effort. Thank you.
I appreciate it.
Yeah, I mean, I think it all goes back to, like, bottom line of today is just having everyone represented, whether that's in government, in local government, in state government, and also in mental health services, in our laws, just really pulling everyone together, because to create a safe community for everyone, it takes everyone. So yeah, I think that's really the bottom line of today. We are a little bit over time, so I'm just gonna see if anyone has any last minute things to add. Any questions, anything we wanted to bring up?
Natalia.
I would like to chime in on something. I would like to just impart to you, because I see such a passion in you, and for such good reason, and it sounds like you're doing so much work for our military, which I just appreciate so much. I have a family military, so thank you. And I wanted to say that it's your heart that will get this laws passed. It will come from you. And I've gone through 2 laws now and 2 different sessions. And you see, I work out of a closet. So I'm a nothing, I'm a nobody, but I had a passion for something, and just keep that fire lit, and just keep the people around you, if it's 1 or 2 that have that same passion, will encourage you. And I believe with all my heart that you can go all the way and get whatever pass that you want. And I at first had reached out and was hoping other people that I thought were stronger in the community, or better placed, more credentials, and nothing happened. It just fell every time. Like you were saying, I reached out and it would just kind of fall there. So I think it just might mean that God says you're the one. But I just want to give you that encouragement, and you can keep my contact information. If I can be of any help of that process, I'll be glad to assist you.
Thank you so much.
Jennifer, I noticed that Ron Lucey jumped off the call, but do you know if the Governor's Committee on People with Disabilities recognizes mental health as a disability? Would that be a good place to do Citizens to be Heard?
Well, I would definitely suggest reaching out to him and finding out. I know that he has helped. I've been involved in so many of their meetings that they've had, and where they came to San Antonio, I think last year, and they want to hear from everyone, and they give you a chance to get on the agenda, and where you can speak. And that's where I started with them. But I would go, he's so open. I would say, reach out to him, call him, email him, and he will let you know right away. And if he's not the one, he'll tell you who is. It's a great resource.
And Larissa, yeah, and that is a committee that actually recommends policy. So they recommended it goes to the governor's committee, and then it ends up in a book that is presented to all of the senators and House representatives coming into the legislative year for consideration in moving forward. So it is.
I mean, you'll go in front of them, you'll present what you have, and like Melanie just said, it'll go in a book of all their recommendations. Doesn't mean you can't go forward without them. It just means it looks a lot better if you can have them on board.
Definitely.
It's a piece of the puzzle. Absolutely.
Absolutely.
Awesome.
Well, thank you all so much. Thank you, Councilwoman Sandoval. Thank you, Melanie. Thank you, Jennifer. Thank you, Sabrina. Thank you, Larissa. Thank you to everyone watching. I was looking forward to this so much. I think it's just such an important conversation to have, and what a better panel to do it. So yeah, thank you all so much for your work in planning this and participating and everything.
Thank you, Councilwoman, as well.
Thanks to everyone. I am so impressed by everything everybody does. I think we're a great group. So, and thanks, Natalia, for putting it all together.
Yes, of course. Thank you.
We're sharing. This is a lot of good information. Thank you.
Absolutely. Yes. Well, thank you so much.